Welcome to Western Perspective, I'm Luke Derrick. Around 2,500 nurses and midwives walked off the job this week to attend an industrial action meeting held by the nursing union. Frustrated health workers have backed calls for a 10% pay rise, a $4,500 one-off payment and better nurse-to-patient ratios.
When we look at politics, we see that nursing and midwifery is treated as a cost. And in the cost efficiency model, it means that costs must be controlled. That means that we need to reduce the number of nurses or midwives. We need to replace them with cheaper workers. But that's old thinking. It's some 50 years old. What we need is a system that values your work, values what nurses are. Now, while I can't talk about the report, I want to say that the report reflects the views of nurses and midwives. I heard so many stories from the nurses who I interviewed, I met with. I heard these stories from my colleagues who are still working in the healthcare system. I heard them from my children's friends who are working in the healthcare system. We need to do something now. Western Australia is facing a shortage and an increasing shortage of nurses and midwives. I work in a global workforce committee looking at the world shortage. Other jurisdictions, other countries are doing something. We need to do it now, or there'll be less of us to care for patients.
Following the rally, we spoke with ANFWA State Secretary Janet Ree about whether the push for a 10% wage rise and a $4,500 one-off cash payment is too radical.
Well, it is a radical increase, and we're going to put that to the Health Minister's office and see what their response is.
I don't think there will be a positive response at this point.
I'm not sure, to be honest. I was quite surprised that the nurses and midwives voted for such a high increase, but as I said, it doesn't hurt to ask.
What does it imply?
Well, they're not happy, they're frightened, and they feel undervalued and taken advantage of by the current state of affairs that the government has with the hospital system.
Are you concerned that there are not enough graduates? In fact, it's dropping at the moment.
Unfortunately, the system has been flooded with graduates and junior nurses, which has put a tremendous strain on the more senior nurses and midwives to try and train and mentor them. We do need to have a steady influx of graduate nurses and midwives to keep the system going in the future. We can't have these sort of boom and bust cycles of nurses and midwives, so I think to keep that stream steady, they need to look at how that's being implemented.
What if the government says they can't afford 10%? What do you have to say to that?
Well, we can keep negotiating and see what they will agree to and see if our members agree with what the government offers.
Do you see this movement continue to escalate, or you're hoping that they will go back down to normal very soon?
I'm hopeful that this meeting today will be enough to make the government listen to our issues and to look at our log of claims more closely. But yeah, if it does escalate, then it does. The members have voted that they want it to escalate if the government continues to ignore us.
And now, here is AMAWA spokesman Dr. Andrew Miller with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. In COVID news this week coming out of Singapore, there's concern around what's being called the XBB variant of Omicron, which is now interestingly more different to SARS-2, the original Wuhan strain, than SARS-1 was. So some people are suggesting this is almost like a SARS-3. What does that mean in practical terms? Do we need to worry? Well, unfortunately, hospitalisations and deaths are on the increase in Singapore at the moment, as we see on our World in data. And the spread of it in a highly vaccinated population, more than 90% of people vaccinated there, which is higher than it is here in Australia now. A lot of people haven't had their third dose, certainly even more than that, haven't had their fourth dose of vaccine here in Australia. So we're seeing what's called immune escape, which is what you would expect from these viruses as they mutate. The ones that are successful are the ones that are going to get around the existing immunity that's out there. So why are we getting the message from our government that everything's pretty much honky-dory and we should go back to living life as normal? they must be very worried watching these developments overseas at the moment, because they're now starting to think that we're going to have to reduce transmission somehow in the future. And the only thing I can speculate is they're letting people have a bit of a holiday without having to worry about it at the moment, and then just accepting that in time they're going to have to come back and say that we will need further restrictions, because our public hospital system certainly can't afford a big impost of patients, as we're starting to see in Singapore now and in places like Germany. And we know that we're short of healthcare workers, and I want to make a comment that I'm in full support of nurses trying to get a better deal out of the government at this stage. In a wealthy state like ours, we should be looking after them preciously, because we're definitely going to need nurses and doctors and everybody else in that system to be well looked after, to look after us for all of our usual problems, let alone potential further waves of COVID with things like the XBB variant coming up. So this is no big surprise. It's not something to be particularly scared and worried about, because we know the tools that we need to control the transmission of these viruses, being masks in crowded indoor places, being up to date with vaccination, hopefully getting some news on vaccinating under 5s in the near future from ATAGI. This might be another thing that gets them down the road to protecting those little kids, and making sure there's really good ventilation, fresh air in all spaces, because the one great thing about fresh air and about ventilating a space, doesn't matter what the virus does, that'll work against every variant of that disease and many other diseases besides. Thanks very much for your time.
And that's Western Perspective for this week. We'll be back again next time, but for now, it's back to you, Ivan and Melly.
Thanks, Luke. And now here's Leo with what's coming up on 6 News tonight.
Thanks, guys. Tonight on 6 News, a massive clean-up effort begins for some, others still under evacuation warnings and on high alert after rain lashes much of the eastern states. Also exclusive, Firefighters Union Secretary Peter Marshall speaks to 6 News about a new pre-election campaign blitz accusing the Andrews government of trashing firefighter cancer laws, and a report finds that Australia's social security system is keeping students in poverty, with the federal government called upon to change age of independence rules. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, or head to our website, 6newsau.com. For now, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. Get the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.